Samples were collected, and within 50 hours, he gave a diagnosis that this was Menkes disease. The patient had not developed at this stage the features of Menkes, the special hair, etc. So this changed the whole thing. They could give treatment with copper histidinate, and the patient is developing normally. So this has been considered a very big advance. Times magazine called this technology one of the 10 most important technologies of 2013. So they said, he is my current hero. He has been appointed the CEO of Pediatric Genomics and Systemic Medicine in San Diego. He has been given $120 million, like 72 crore rupees. When he accepted the job, he said, I want to go and visit this institute if they have the passion to change practice of pediatrics. This is what he thinks. This technology is going to change the practice of pediatrics. So they published very recently. So in one go, they studied all the known 5,500 Mendelian gene disorders. In 57%, they were able to find an answer. They select patients in the neonatal unit. It's not at all cases. By conventional technique, they could only got answer in 9%. And this changed the clinical management. In some cases, the uncurable disease, they went on to palliative care and they changed diet and surgery. So it was useful. As you know, the NGS technology, it is an ideal technique for discovery of new genes and see how the new genes are being discovered. So in 2012, 130 genes were discovered in 2012. Every month, 20 new genes are being discovered by using this technology. Changing the scene in cancer. You know, there is a cancer genome atlas, which the world is being developed at the NIH. The pilot was started in 2006. 30 cancers were taken, cost $375 million, 150 scientists. India is doing the studies on oral cancer. The mandate was to check the mutations in all the tumor types and learn about the cancer biology. So, by these studies, Forbusian published in the New England Journal of Medicine that in these 4 cancers, melanoma, pancreatic cancer, cervical cancer, and colon cancer, that the first mutation that occurs is here. Here is always the APC. And what happens in the cell, one of the cells develops this mutation. The second phase, there is another mutation, and then the cell divides to divide. And the third, then there is a series of mutations, then the cell becomes invasive and spreads. And each phase takes about 10 years. So you are not going to get all the 3 changes instantly or continuously. So it is a cancer is a disease spreads over time. It's not just one. It takes 20 to 30 years to develop cancer. So now the cancer field is being changing because we can do what is called the liquid biopsy. You see the plasma and the cells circulating in the blood. Some of these are derived from cancer. And you have the free DNA, you have the exome, that you can do RNA studies, and you can diagnose cancer. So this is what people are doing. You take a sample of blood before the cancer has caused any symptoms. You find there are changes in the blood. Small DNA from the cancer comes out into the tissues. It is best illustrated, by example, the power of this technology by chronic myeloid leukemia. You know, there's the chronic myeloid leukemia. And the first they said there's a deletion of chromosome 21. Oh, sorry, 22. And Dr. Agarwal had trained in this institute where they discovered this. Then Janet Rowley came and said, no, it's not a deletion, it actually is a translocation. What is deleted here is translocated here. And then, of course, an understanding of the molecular biology, that there are the shifting of the genes from BCR1 22 and ABL9. So there was the fusion protein, and which of of course, cause the firing, continuous making of the cells. And you could put a drug here and prevent the disease. So Bruker discovered this, and they discovered immunity. So now the issue is that we can discover there is some resistance to the issue, and you have to use newer drugs. So kidney disease, for example, you think kidney disease may have no genetics. At least for years, steroid-resistant nephrotic syndrome. At least 25% of childhood and 15% of adult cases, they are due to mutations in the genes. And the congenital nephrotic syndrome, 85% in the first 15 months of life, they have these genes, 4 common genes. So there is another disease called the adult polycystic kidney disease. This is a disease commoner than thalassemia, commoner than hemophilia, commoner than muscular dystrophy. Affects like 1 in 500 people. And now understanding the biology, there is already some treatment being tried called the mTOR inhibition. So prenatal diagnosis, we have been doing this, and Dr. Soni has set up with his wife some prenatal diagnostic center here. So you use the clinical history, you use biochemical screening, you use the ultrasound. And then of course, to confirm you do the CVS or amniocentesis, and you confirm chromosomal diseases, molecular tests and biochemical tests. But now this NIPD, the non-invasive prenatal diagnosis, has changed the field. There is no risk of miscarrying. You are not putting a needle in the uterus. And this has reduced the frequency of invasive testing by almost 70% in the US. Also, it has reduced the income of the obstetricians also. So here, what happens, the placenta, which is essentially from the baby, some apoptotic cells give up their DNA and RNA, which floats in the plasma. And with studying them, there are 5 techniques, 5 companies who are marketing this, and one company based on SNPs, while the others just count the fragments, and they can give you a diagnosis. So we have carried out studies in about 758 antenatal women over the last 3 years, and in 733 diagnoses have been correct. In 23 we found aneuploidies, chromosomal trisomy in 12 cases, and some of the others, but it's still a screening test. So when we confirm, we found only 10 of the 12 actually were truly trisomic ones, and here only 1 of them. So it is still a screening test, but it reduces many amniocentesis, and you are only doing very limited amniocentesis. So cost is reduced, the miscarriage rate is reduced. So genetic diagnosis is not a dead end. Use a website, you can find almost 300 metabolic diseases which can be treated. And then we have of course the enzyme replacement therapy for the lysosomal disorders, and we should be taking this of course is a Gaucher disease patient before the therapy and he is after the therapy. Similarly, MPS1 before therapy and after therapy. So we should be thankful to the enzyme because they are giving a free charitable program, and almost 60 patients are being treated by Gaucher with a free enzyme, and therefore the point is. But in Hunter disease, these are being treated from an enzyme made by Shire. And there are some others. There are many other things are coming up. Here is a paper, treatment of cystic fibrosis. So, first they discovered this. VX702 and 7 whatever. So here, the lumotester was introduced. It only worked in a particular type of mutation, only this one, Evotaftor. Then they found that if it is a delta 508, which is a common mutation, it makes protein but it degenerates. So they found a compound which can prevent this. So if you give these 2 drugs together, 50% of cystic fibrosis you can help. At the moment, it's approved for treatment only of above age 10, not in the younger ones. But it will also change. This is what we need to do. Gene therapy for thalassemia. We've been talking for a long time. The Sloan Kettering, Dr. Sedlin used to do this, but I could not find any recent update. But what I did find, this company called Bluebird Bio. So you do something like a bone marrow transplant, But you take the same cells from the patient and the CD34, you introduce a gene which is called the HB287Q. This is an artificially constructed globin gene which is introduced into the globin gene. It just attaches in the gene, hemoglobin gene. And then these are transfused back into the patient. So it's called, you have to use a virus to get the gene into the cell. 6 of the 6 non-B plus, or actually non-B0, it should be B0, they became transfusion independent over a period of 6 months. While the BO ones, they had a varying degree of free from transfusions. So you find this red one is the special hemoglobin that they introduced, and you see over months it increases. So the hemoglobin increased by 5.2 grams over a few months, while the total hemoglobin was 8.5 to 11. So it's a big advance. They already started talking that this company is going to cure sickle cell disease in the next 10 years. Their shares have jumped by 10 times. So they did a very clever thing to treat sickle cell. In sickling, you get the RBCs, they join together and they block the blood vessels. So what they did in the normal hemoglobin, they changed one amino acid, which was present in fetal hemoglobin. And this prevents the sickling. So by their treatment, the way I explained to you, 50% of the non-sickling hemoglobin was made in this body. Although it required a sort of transplant type of stuff. But that's why I said, they already claiming that this may have cured disease. Then there was the technology of exon skipping in Down syndrome, in DMD, and there is what they call exon inclusion in SMN, the spinal muscular atrophy, but I will not go into the details. My last 2 slides, in 1871, there was a huge fire in Chicago. It burned 1/3 of Chicago. It lasted 3 days, and then the rains came and it stopped. So they called the architect, and this was the man, Daniel Berman, that do something to rebuild Chicago. He said, make no small plans, for they have no magic to stir man's blood. So he said, make big plans. And he was the originator of the skyscrapers. So this is what I want the society to do in the Indian Academy of Genetics. Develop a multi-scientific project on the therapy of genetic disorders. Take common genetic disorders, study the mutations that can be targeted, like the spike site mutation and the PTC stop codons, and then of course develop treatment for the DMDs and SMAs. Because the treatments are there, but they are very expensive. So unless we develop them in India, you will not be able to make them available to our patients. So that's the acknowledgement to my colleagues at Surgery and Genetics Department. Thank you very much.
Thank you so much, sir, for the excellent talk. May I please request Dr. J.P. Soni, the organizing secretary of this conference, to propose the vote of thanks.
Good morning, everybody. On the behalf of organizing committee, I myself and Dr. Kuldeep once again give many thanks to all the delegates and all the faculties and speakers who had come all the way from different parts of countries and different parts of the world to attend this conference and make this conference successful. On the behalf of organizing committee, I would like to thank guest of honor, Dr. Dayendra, Dr. Suha Phadke, the president of SIMG, Director Sanjay Mishra ji from the AIMS, and all other faculties for giving this all support to organize this conference with the help of Dr. S.N. Medical College and AIMS Jodhpur. And I also like to thank many sponsors who have given all the supports financially as well as by their work and by their contribution to make this conference successful. And I also thank my Dr. Kuldeep for giving all the support to organize this conference. Thank you, sir. And the quiz for this conference will be held at 5 p.m. in the evening. Thank you.
Thank you, sir. May I request all of you to rise up for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्छल जलधि तरंगा तब शुभ नामे जागे तब शुभ आशीष मांगे गाहे तब जय गाथा जन गण मंगल दायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Everyone is requested to join us for high tea. The high tea will be followed by Dr. S.S. Agarwal oration. Thank you all for being with us today.